Hi, I'm Peter Gloviczki, Editor-in-Chief of the Journal of Vascular Surgery and Professor of Surgery Emeritus at Mayo Clinic in Rochester, Minnesota. Together with my co-editor, Dr. Peter Lorenz from UCLA Medical School, we are excited to bring you the September issue of the Journal of Vascular Surgery. Thanks to you, we received many positive comments on the new cover of the journal and also on the fully redesigned table of content and the brief highlights we added to the articles. The Editor's Choice article in September was written by Dr. Anahita Dua and colleagues from Milwaukee, Wisconsin, Springfield, Illinois, and Charlottesville, Virginia, on predictors of poor outcome after carotid interventions. Dr. Dua and colleagues used the National Inpatient Sample and State Ambulatory Services database and identified over 1.7 million patients who underwent either endarterectomy or stenting for carotid artery disease between 1998 and 2012. Overall stroke and death rate in asymptomatic patients was 1.5% after endarterectomy and 1.7% after stenting. In symptomatic patients it was 3% after endarterectomy and 3.8% after stenting. For risk-matched asymptomatic and symptomatic patients, female gender and performing less than 3 cases per year were associated with higher risk of stroke and mortality. Female gender was one of the strongest overall predictors of adverse events after carotid artery stenting, with an odds ratio of 21.39 for mortality. The high rate of early stroke and death in women after stenting is an unexpected finding, and it may indicate that women are vulnerable to complications after endovascular procedures. The authors concluded that patients who undergo carotid endarterectomy continue to have superior outcomes compared with matched cohorts who undergo carotid artery stenting. The CME article in September is on the improving mortality trends for hospitalization of aortic dissection. Dr. Zimmerman and colleagues from Mayo Clinic in Rochester, Minnesota identified 15,641 patients who were admitted to hospitals with primary diagnosis of aortic dissection. Overall weighted admissions for aortic dissection increased significantly during the 10-year period of the study, with increases in open repairs for type A dissections and a striking increase in endovascular repairs. The number of patients who underwent medical treatment or open surgery for type B dissections remained stable. Overall, in-hospital mortality of aortic dissections decreased in this study from 18.1% to 13%, but mortality after open repair for type B dissection decreased in high-volume centers only. Mortality after TEVAR was only 7.9%, but it did not decrease during the 10 years of the study. So the authors concluded that targets for improvement in mortality after TEVAR need to be identified, and also that regionalization of open surgical care for type B dissection in high-volume centers is warranted. Another highlight of the September issue comes from Jeremy Darling and colleagues from Dr. Schermerhorn's group in Boston. This paper deals with the SVS new threatened lower extremity classification system that reflects the 3 major factors that impact amputation risk and clinical management: wound, ischemia, and foot infection. From here comes the acronym Y5. The goal was to evaluate the ability of this scale to predict outcome after endovascular interventions. This single-center retrospective study of 596 limbs with critical limb ischemia indeed supports the ability of the SVS Y5 classification system not only to predict one-year amputation risk, but also reinterventions, restenosis, and wound healing in patients undergoing endovascular infrapopliteal revascularization. Finally, another highlight of this issue deals with that important phone call to your patient 1 week after hospital discharge. Dr. Hornick and colleagues from the Washington University in St. Louis called 131 vascular patients after an operation and discharge and found that pain requiring prescription medication and continued dressing applications were risk factors of 30-day readmission. The authors concluded that implementing a 1-week post-discharge phone call can help identify risk factors associated with early hospital readmission. So call your patients at least once after you discharge them from the hospital. These were just a few of the many great articles from our September issue. To access these articles free in September, please visit us on www.jvasksurge.org. Enjoy reading JVS journals and please remember to send us your comments and suggestions. See you next time for the highlights of the October issue of the Journal of Vascular Surgery.